My name is Pamela Johnson. I chose to research the legalization of marijuana for the use of helping improve the quality of life of cancer patients. I chose this because I know firsthand how difficult it is for the patient themselves and their family members to go through it. Watching your loved ones suffer until they die will give you reason to fight for something that may ease the suffering even a little bit. I think medical marijuana could provide that ease. I hypothesize that medical marijuana will indeed prove beneficial to cancer patients and maybe even others with difficult conditions, and that those benefits will outweigh any potential costs of its usage. I'm aiming this research project both towards lawmakers of the U.S., especially the federal government, so that they too will fight for medical marijuana's legalization. I'm also aiming this research project toward other individuals who may help me in convincing lawmakers to take action. I hope that from my project, my audience will gain a greater understanding of the experience of cancer patients and how marijuana could be a legitimate solution to help make it a little easier for them. The type of symptoms of cancer and chemotherapy that cancer patients undergo include nausea and vomiting, pain, and loss of appetite. My hypothesis is supported by Cairns and Kelly, who are both credible because they have PhDs and they're affiliated with the Department of Pharmacology, who explain that Canada uses multiple different types of cannabinoids, which are marijuana-based medicines, to treat both nausea and vomiting in cancer patients, as well as pain. Dronabinol and nabilone are prescribed to treat nausea and vomiting, and nabiximols are prescribed to treat pain. The Canadian Cancer Society, credible because they are the national organization in Canada responsible for a significant amount of research on cancer, also supports this. And as they explain, doctors generally prescribe cannabinoids. If other alternatives aren't first effective in treating these symptoms. Ted Bosworth is a credible news deliverer who specialized in analyzing pain care and primary care, and he explains how marijuana can moderately alleviate neuropathic pain that cancer patients endure. But any ease of the pain is worth it, especially when no other solution helps. Amanda Chan, credible because she has 3 bachelor degrees in her specialty, journalism from 3 major universities, as an article of lifescience.com called Marijuana's active ingredient improves cancer patients' appetites, which also supports my hypothesis. Because she elaborates on a study which showed that 73% of cancer patients who took THC pills every day for 18 days reported an increased appreciation for food, compared with 30% of patients who took a placebo, and 64% of patients who took THC reported an increased appetite, compared with 50% of patients who took a placebo. Patel and Roger credible because they are currently working with Vanderbilt University Medical Center at the Department of Molecular Physiology and Biophysics. Back this up by explaining the neurological mechanism cannabinoids like THC have for stimulating hunger. They explain that the cluster of cells in the hypothalamus, the brain's drive control center associated with hunger and thirst, is affected by cannabinoids, which override the appetite suppressing peptides and activate instead only the appetite stimulating ones, causing an exaggerated feeling of hunger. I anticipate that as more and more states legalize marijuana for medicinal purposes, More studies will be conducted on the benefits of its use on cancer patients and how it improves their quality of life. From there, more states will be influenced to legalize it as well. I should research more about the perspective of cancer patients who have used medical marijuana and report on their experience with it. My hypothesis is well supported. I have found no other study that argues the medical marijuana doesn't help cancer patients in some way. I still question the extent that marijuana alleviates their suffering, but as I said, any amount of help is crucial in those times. I expect to reach the conclusion that marijuana should definitely be legalized for medicinal purposes because it helps cancer patients in a variety of ways, and any risks of its use are mild, if not even applicable to their situations.